is the most likely cause of this patient's subarachnoid hemorrhage? Okay. 45-year-old woman brought to the ED, sudden severe headache, began an hour ago. Describes the pain as the worst headache of her life. Medical history includes hypertension, which she takes hydrochlorothiazide. On physical examination, she has a blood pressure pretty high, 180 over 110, stiff neck. Non-contrast CT of her head reveals blood in the subarachnoid space. Um, let's see if I remember what this is. Ruptured AV malformation. I was looking for like ruptured something. Intracranial aneurysm. I don't think so because it's more on the outside. It's like that subarachnoid space, like they're saying. Hyperintensive intra cerebral. No, it's not in the cerebrum. Traumatic head injury, I do not think causes this. Um, Venous sinus thrombosis. It's not the worst choice. Um, hmm, I don't think it's anything intra. I'm just trying to think of where would the AV malformation be? I don't know if that's the right picture for this. Ruptured intracranial aneurysm.
So work yourself through kind of the history. Maybe that'll help you, right? So,
Okay.
younger, middle-aged woman, right?
Yep.
Sudden severe headache. That's the symptom that happened.
Mm-hmm.
So they describe it worst headache of her life. She has hypertension, and then all of a sudden, she has this subarachnoid space blood. So what kind of fits that picture to you the best, right? That can
I
start off
mean,
as severe.
thrombosis does too. So like I like rupture and I like thrombosis.
Okay.
Um, I'm just wondering if that's where like if you throw like a thrombosis like that. I
So
definitely think some
what risk factors do you need to have a thrombosis?
hypertension, right?
It could be one, but how many people that have high blood pressure gets clots?
Not everybody, because a lot of
Yeah,
people
not
have hyperblood.
yeah,
Yeah.
not too many, I would say, right?
Okay.
More people that you should think of for clots is you remember the coag, right? The triad
Yep.
coag, it's like stasis and hypercoagulability, and I can't remember if it's too, I think too cold blood maybe. But anyway, so or stasis of blood, right? So
Yep.
she's not really on OCPs, which can increase
Right. That's what I was thinking too. So my
hypercoag.
first thought was like OCPs, and if they said like, oh, they're on a long flight or something like that,
Yeah,
that would
so
make more sense.
Yeah, so she's not kind of in the patient population for a thrombus, I would say, right? Like she
Okay.
doesn't have like factor five Leiden or any kind of history of
Right.
stuff like that. So I would probably move away from venous sinus thrombosis.
Okay. Um, hmm, I'm trying to think. She has this hypertension. Um, I just I would like hypertensive intracerebral hemorrhage, but that's not really where the brain bleed is. It's
Okay,
on the
good.
subarachnoid space, so I got rid of that. Traumatic head injury is always that's never like a bad choice. It's just I don't think that usually happens with these like severe subarachnoid hemorrhage headaches. I don't. It's usually
Okay.
like they could be passive and just all of a sudden they say the worst headache of my life. So it goes back to like when I was first thinking, I'm like, okay, ruptured something. I just remember something about like those subarachnoid veins or like that venous formation is what causes a lot of this. So um that was my first guess. I just don't remember why would you have an AV malformation in that space. I'm not putting that together. Um even though I think that's what I would pick,
Okay.
unless it's ruptured intracranial, which makes sense because it's in that. Yeah, because why would you have an AV malformation like in your head there? Yeah, maybe I do the aneurysm.
Okay.
Okay. Not sure though. I'm not sure about this.
Yeah, so let's talk about this, right? So it's actually the subarachnoid space is usually done by usually an aneurysm that's ruptured in the circle of Willis. Okay, or
Okay.
aka a Sackler/Berry aneurysm. Okay,
Okay.
when those rupture, they get blood in the subarachnoid space.
Okay.
Okay, but remember, any kind of an aneurysm that ruptures, especially causing this picture is usually they're going to describe the patient with the worst headache of their life with a sacral or berry aneurysm that ruptures.
Yes. Okay.
So I want you to remember that, right? They always say it's like a thunderclap headache, right? Worst
Yep.
headache of their life, right? Then all of a sudden, right, they like don't do well, right? Because
Hmm.
and obviously you have a uncontrolled hypertension can pop that aneurysm, right? But AV malformation, very, very, you know, uncommon, right? That's super
For
uncommon.
this presentation, right? That doesn't make
Yeah,
sense.
yeah,
Okay.
they can still have a subarachnoid hemorrhage with an AV malformation for sure, but just very rare, right? Traumatic brain injury, right? No, no, they usually give you some kind of trauma, right?
Yes.
Hypertension, intracranial hemorrhage, right? This can happen with high blood pressure for sure, but usually it's in the basal ganglia. Okay.
Hmm.
So it's deep in the brain. So not gonna cause a subarachnoid hemorrhage, right? And then venous
Okay.
sinus thrombosis, right? Like I said, you need history of clotting issues, right? And you can get headache, seizures, things like that. But you have to have history of clots, right? So it
Okay.
doesn't really happen randomly, I would say.